Good morning, everyone, and welcome to the 9th NCISH Annual Conference. Really delighted that you can join us today. So we're going to be hearing the key findings from the 2023 annual report, as well as some of the wider research being undertaken by the Centre for Mental Health and Safety. I'm really delighted to be chairing today's conference. My name is Pratibha Jitsabeesan. I'm a consultant in child and adolescent psychiatry, and I'm also the National Clinical Director for Children's Mental Health at NHS England. So a little bit of housekeeping before we start. The session will be recorded. It'll be uploaded onto the NCISH website along with the slides and the annual report. We're not going to be taking questions after each speaker. Instead, we're going to be collecting all of those questions for the panel discussion at the end of the conference. So please do put your questions in the Q&A function of the chat box. We know the topic that we're going to be covering today is really sensitive. I know many people joining today will be clinicians, but we've got people joining who will also have personal experiences of loss. So please do take the time to look after your own mental health and well-being. If you need to dip out to the conference, please do so. I think most of you joining today will be really aware of NCISH, the National Confidential Inquiry. They've been collecting data on the deaths of children, young people and adults by suicide since 1996, so over 25 years. And those include deaths in the general population, as well as patients in contact with mental health services. It does mean that they have developed a really unique data set. And it does mean that that research and that data set can inform national policy. It's informed the current national suicide prevention strategy in England. I'm sure it will also be key in informing the new suicide prevention plan that will be launched later this year. But it's important to remember that NCISH is also clinically led, and we're going to be hearing from a number of those clinical leads during the course of today's conference. I think many of us joining as clinicians and practitioners will be really interested in thinking about how do those key themes translate into day-to-day practice for us. So particularly for patients who come into contact with mental health services. I wanted to take the opportunity to just add a few of my own personal reflections over the course of the last 12 months. I'm particularly concerned about the impact of COVID on people's mental health. I'm going to talk about that particularly in relation to children in a moment. I think many of us really concerned about the impact of the cost of living crisis, economic adversity. We know that economic downturns unfortunately increase rates of mental health needs, as well as potentially suicides. And I think that was really probably most evident in the 2008 recession. So we're really fortunate in the panel discussion to be joined by Helen Undy from Money and Mental Health. So hopefully an opportunity to think about some really practical things we can consider with the patients and the people that we see within our services. The other real concern for me is really about the pressure that we're seeing across the NHS and the impact that has on staff mental health and well-being. We know that the mental health and well-being of staff does really influence the safety and the quality of our services. On a positive note, last year in England, we also saw the introduction of integrated care boards and integrated care partnerships. This is, I think, such an important opportunity for us to start to strengthen local population-based healthcare and hopefully working across agencies and supporting suicide prevention. So as a child psychiatrist, I did want to take the opportunity to also just reflect on what's happening for children and young people. I think in this country, like many other countries, there are concerns about the impact of COVID. We've seen a rapid rise in young people developing mental health needs. I think some of you will have seen the data from the ONS that shows that rapid increase in the prevalence of young people with mental health needs from 2017, where it was about 12% for young people 7 to 16 years of age, up to 18% last year. But the other, I think, key theme from some of the research is that COVID did not have an equal impact on all children and young people. It had a disproportionately greater impact on certain vulnerable groups. And that includes young people from areas of greater social deprivation, young people from racialized communities, young people with special educational needs, so neurodiversity, as well as young people who identify as being LGBT+. And they may be groups, as you'll see in a moment, who may also be at greater risk of self-harm or suicide. So there are concerns for me that health inequalities might have widened as a consequence of COVID. So there is more investment going into community services. We are seeing more children and young people now than ever, but that treatment gap has widened. So we do need more investment to ensure that we are reaching more children and young people now than ever. And one of the programmes that I'm really keen that we advance is our mental health support teams across schools and colleges. But it isn't just about more funding. It is also about, I think, changing our models of care. So we work in that more integrated way across health, education and social care in partnership with the voluntary sector to also make sure that our services are more accessible for all of our children and young people. And that includes young people from some of our more marginalised and vulnerable communities. So what's happening for suicides in young people? But when we look at some of the data from NCISH, it appears that 2 to 3% of all suicides across the age span occur in young people under the age of 18. Now that might sound relatively low in comparison to adults, but I think all of us know the devastating impact a suicide has on families, peers or communities left behind. We are really fortunate today to be joined by Ian Russell. He's going to share the story of Molly, his daughter, who sadly died at the age of 14 in 2017. So I think a really important way of setting the scene for today's conference, which is ultimately about our local communities and the populations we serve. The other concern I have is that in the UK, suicide is the leading cause of death for young people 10 to 18 years of age. We're going to be hearing shortly from Lewis. I think the other worry that I have is about rising rates of suicide in young people. So there are lots of, I think, concerns about why we do need to focus on young people. On a positive note, I think some of you might be aware of the National Child Mortality Database that was introduced in England. They published a report in 2021 identifying particular themes associated with suicide in young people. It matches really closely to some of the themes identified in the NCISH report. So for people working with young people, you might be interested in both of those reports. What was positive is that in response to COVID, the National Child Mortality Database have been able to introduce real-time surveillance data collection. So being able to follow trends in all young people who die, including by suicide, so we're able to respond more quickly. So a lot of development still happening to support suicide prevention. So I'm going to move us on to the programme. We've got a really packed agenda ahead of you. So if you look at your booklet, hopefully you'll see that we're going to be starting very shortly from hearing from Ian Russell. He'll then be followed by Lewis Appleby, who'll be sharing the key findings from the 2023 annual report. We'll have a short 15-minute break. And after the break, we're going to be hearing from Nav Kapoor, who's going to probably have a spotlight on 2 or 3 key areas. So some real practical things for us to consider. We're then going to move to the panel discussion, where we'll be joined by Helen Undy from Money and Mental Health, and also Jenny Shaw from the Centre, from the National Confidential Inquiry. So additional experts to really join that panel discussion. So I think before I introduced Ian, we've got a welcome message from the Chancellor of the University of Manchester, Nazir Afzal. So I think we're going to play that particular recording.
Good morning, and welcome to all of the people who are joining us to hear the latest data from the National Confidential Inquiry. I am Nazir Afzal, and I am privileged to be the Chancellor of the University of Manchester. This university is proud to support the work of the inquiry. I learnt that the National Confidential Inquiry into Suicide and Safety, the NCISH, is an internationally unique project collecting in-depth information on all suicides in the UK since 1996. and making recommendations to improve safety in mental health. This annual conference is an opportunity to hear about and discuss the findings from the 2023 NCISH report, and the report includes information about the critical settings in which patient suicides have occurred, the care that patients received before they died, and the problems they faced. I have to acknowledge the sensitivity of the subject. Many lives are affected, including many in the audience, whether from personal experience or the work that they do. I lost somebody very close to me to suicide a few years ago, and have always asked myself whether I could have done anything different. In truth, probably not. But I know the universities have become more aware of mental health and suicide prevention, and Manchester University has worked with local NHS to support students struggling with their mental health. This service for students, which I've seen, is a national leader. For effective suicide prevention, you need good data. The National Confidential Inquiry has been collecting national data for more than 25 years. The new report presents data on deaths that occurred between 2010 and 2020. Learning from these deaths can help prevent future suicides. The NCISH recommendations have contributed to a reduction in patient suicide rates, and their evidence is cited in national policies and clinical guidance and regulations in all the UK countries. Today you'll hear from the NCISH team about the latest evidence and recommendations to improve safety and to reduce suicide under mental health care. I welcome you again. We can learn a lot today, and I hope that you will take away enormous lessons. I hope that you can in some way enjoy today. Thank you.
So fantastic to hear from Nazir Afzal, and just echoing his welcome to all of you. And I've just been looking at the chat box, and it is fantastic that people are introducing themselves in the chat box. Please do that. I do think these conferences are a great opportunity to network. So do also put questions. Remember to put questions in the Q&A function as well. I'm going to move on to our very first speaker of today's conference, and it gives me great pleasure to introduce Ian Russell. So Ian is the father of Molly Russell, and Molly sadly died in November 2017 at the age of 14 by suicide. And the coroner's inquest that concluded in September 2022, and I know many of us were closely following that coroner's inquest, concluded that Molly had died from an act of self-harm while suffering from depression and the negative effects of online content. So the Russell family, their friends, have established the Molly Rose Foundation. I know, Ian, you and the family have worked tirelessly really to increase awareness. You provided evidence to government on the online safety bill. Some people will know that's currently going through the House of Lords. So we are really grateful that you've taken the time to share Molly's story with us. Thank you, Ian.
Well, Pratima, thank you very much. Good morning, everyone. It's an absolute honour to speak at this NCISH event this morning. And as you've heard, the story I'm about to tell is a sad one, and it's only the story of my experience. I'm a very ordinary person, and that's really all I can contribute. But I hope it proves useful. The Russell family lived a comfortable but unremarkable life in the suburbs of northwest London. We counted skiing holidays and sailing, horse trips, horse riding and trips to the theatre, and gatherings of friends and family among our memorable highlights. The youngest member of our family was my daughter Molly. She was endearing, self-sufficient and a quick learner. She easily rose to the challenges of school. Not super bright, just seemingly capable. Molly was emotionally intelligent and above all, caring. One of the most caring people I've ever known. Molly was an adorable young person who showed no obvious sign of mental ill health. The weekend before Molly's death, we celebrated the 18th and 21st birthdays of her two older sisters, all three of them born in November. We also toasted Molly's health. She'd been particularly busy helping prepare us for our big party, and we wished all 3 daughters a happy birthday. Molly died the day before her sister's 18th birthday and 6 days before her own 15th, having written a combined birthday and Christmas list and presented it excitedly to the rest of the family, obviously looking forward to her presents to come. The night before she died, Molly attended rehearsals for her school play. She'd been given the lead role. She completed her homework and handed it in online, and she packed her bag ready for school the next day. As ever, forward-looking Molly asked me about work experience opportunities for the following summer, and then we'd sat down as a family together to watch I'm a Celebrity. Before bed, I popped my head around her door and in the usual way said, "See you tomorrow morning, Molly." And she replied, "See you tomorrow, Dad." That was our last conversation. The events of the 21st of November 2017 will live forever engraved on my soul. The shock, the confusion, the pain, the grief, the hurt, the questions. By midday, for the first time again, we sat alone around our kitchen table as a family of 4, struggling to come to terms with what had happened. By then, the paramedic, police officers, and Molly's body had all left our home and left it feeling eternally emptier. Molly's locked iPhone and iPod Touch had been taken as evidence by the police, along with some handwritten notes from Molly, at that point unseen by us. It was to take days before we were provided with photocopies of Molly's notes. And while we waited, we searched for more information, desperate to quell our new demons by finding out whatever we could about whatever had happened. We discovered some more notes hidden in Molly's bedroom. One said, "Sometimes my mind is like a little boat out in the middle of the sea in a big storm. I'm all alone and all the waves are crushing down on me, drowning me each time. It's getting harder to breathe. I try and sail away from the storm and I'm good for a couple of days, but the storm will eventually catch up to me and I could try and sail through the storm, but I'm too tired and I may not make it out alive. So I stay where I am, hoping the storm will pass me, but it's taking too long and I'm not that strong." How could Molly think this? She was an adorable young person who showed no obvious sign of mental ill health. I needed to try and understand more about suicide and what lies behind it. A family friend who's a nurse gave us the Public Health England National Suicide Prevention Alliance booklet called Help is at Hand. We'd received no support from the authorities, lest a visit from our GP on the day of Molly's death. That guide was vital and contained some good advice and recommended Professor Mark Williams' book, Cry of Pain, Understanding Suicide and the Suicidal Mind. So I ordered a copy in the hope I might pick up some of the basics. Still full of grief and loss, and with my emotions swirling like an internal tornado, at times simultaneously unable to pick the book up nor put it down. As a bereaved parent recounting his lived experience, I hesitate to mention this given so many experts are attending today, but among the things I took from the book were Emil Durkheim's suggestion that suicide should be seen as a feature of society and not the individual. That social comparison can lead to feelings of self-denigration, worthlessness and despair. And I've since found that these are feelings that crisis text lines, for example, have found to be indicative of a particularly high risk in those seeking support when having suicidal thoughts. And the Werther effect after the 1774 novel and the Angie phenomenon after EastEnders in 1986, they considered whether high-profile cases, in those cases fictional cases, might lead to imitative suicidal behaviour. Quite a lot to take in for a bereaved parent. But above all, I learned that suicide is such a complex subject, especially for the layperson. And even for the experts, our collective knowledge seems to remain incomplete. In our family's quest to learn whatever we could, it wasn't long before we found harmful content on Molly's online accounts. She hadn't seemed to be much of a social media person. Molly had deleted Twitter as she didn't use it. She never had a Facebook account. But on accounts we could access, YouTube, Instagram, and Pinterest. Among the pop stars, celebrities, and influencers, followed by 14-year-olds, we found shocking content that quickly led me to the conclusion: social media helped kill my daughter. Some posts were immediately shocking, for example, those showing graphic self-harm content, and these were often predominantly red in colour. But the posts we found most disturbing were usually black and white, and the depression and suicide encouraging harm they inflicted on those who saw them took time to develop and to grow within us. One of the conundrums we faced as a family was how to raise awareness about these easily discovered and widely available harms without unduly promoting them. So we set up the Molly Rose Foundation, a charity to raise awareness and to help connect young people with suicidal thoughts to the help and support they need. Many young people told us that they'd already seen such harms, and now there's a growing body of evidence to support this view. Last year, Samaritans published initial findings of a study undertaken by Swansea University, which found that over 3/4 of children had seen online harms by the time they were 14, often much younger. And of those, 83% had not sought the harms had found them. So choosing not to talk about online harms clearly does not seem to protect young people who are already likely to have experienced them. And choosing not to talk about online harms is also a choice not to raise awareness of their dangers and to allow them to continue to present a greater risk than they otherwise might. So on that basis, and with a warning, I'm now going to describe, not show, but describe 3 of the less harmful Instagram posts that Molly engaged with. One showed a pencil-like drawing of a sad-looking girl and simply said, "Who would love a suicidal girl?" Molly and 1,747 others had liked it. Then beside another pencil-like drawing of a sad-looking girl, this time with bandaged eyes in bed cuddling a teddy bear, another said, "This world is so cruel and I don't want to see it anymore." Molly and 2,432 others had liked this. And one post containing only text said, "The worst thing depression did to me was to take my intelligence. Feeling yourself getting dumber and dumber is absolutely painful." That was the last post Molly saved before her death. Whenever posts like these were reported to Instagram, we got the same reply. They didn't contravene their community guidelines and so would not be removed. And then there were posts, many posts, saying something along these lines. "I'm the weird sister, quiet daughter, depressed friend, lonely classmate. I'm nothing, I'm worthless, I'm numb, I'm lost, I'm weak, I'm gone, I'm sorry." In fact, although it's nearly identical to posts Molly had engaged with, that's another extract from one of her handwritten notes, a note which Molly ended by saying, "I'll see you in a little while. I love you all so much. Have a happy life. Stay strong." Within a couple of weeks of Molly's death, the police returned her iPhone and iPod Touch, convinced her death was simply a straightforward tragedy. I didn't see it as such an open and shut case, so I emailed the senior coroner, Andrew Walker, explaining I thought it important to access Molly's data to learn more about how online content may have contributed to her death. He immediately directed the police to retrieve Molly's electronic devices and to extract the data from them. And so began, in earnest, the nearly 5-year quest to gather data from Molly's digital accounts as part of her inquest process. Despite the coroner's direction, limited police resources meant their data labs triaged cases. Presumably priorities lay elsewhere. So it was to take almost 2 years for the police to recover Molly's data. And while we waited, the options to learn from Molly's death seemed to be receding, and as they did, my sense of despondency increased. After much consideration, as a family, we decided to tell Molly's story publicly in the hope of raising awareness about online harms and their possible link to suicidal behaviour. The story was the headline item on the BBC 6 o'clock news on the 22nd of January 2019. And by 9 p.m. that evening, reporters were knocking at our door asking for statements. Since then, we've grown used to hearing Molly's story in the media. I don't think a month has gone by when I haven't seen her photo on the TV or in the papers. And all of this, despite not wanting Molly to be put on a pedestal. Every suicide is a tragedy, and every year in the UK there are something like 200 school-aged children who take their own lives. Each of those lives deserves to be remembered for the joy they have brought and lamented for the love that has been lost. Some newspapers asked us if we'd support a campaign for Molly's Law to combat harmful online content. We politely declined, thinking no individual should become the poster boy or girl for this cause, however much we supported its aims. However, there were some rapid positive changes. Within a fortnight of Molly's story breaking, Adam Mosseri, head of Instagram, was scrambled to London to respond. On the 4th of February, The Telegraph published an op-ed in which he wrote, "I have been deeply moved by the tragic stories that have come to light this past month of Molly Russell and other families affected by suicide and self-harm. We rely heavily on our community to report this content and remove it as soon as it's found. The bottom line is we do not yet find enough of these images before they're seen by other people. This week, we are meeting experts and academics to talk through how we answer these questions. We are committed to publicly sharing what we learn. We deeply want to get this right, and we will do everything we can to make that happen." So it's interesting to note that a couple of years later, in September 21, the Wall Street Journal, in their Facebook files, reported that Facebook's own research said among the teens who reported suicidal thoughts, 13% of British users and 6% of Americans traced their desire to kill themselves to Instagram. One single platform. So much for transparency and sharing what was learned. We would not know this at all if it wasn't for the courage of the former Facebook employee, Frances Haugen. It's because of situations like this that I've found it's best not to judge organisations by their words, but instead judge them by their actions. Also in 2019, the police submitted data from Molly's electronic devices to her inquest. Distressingly, the data revealed that Molly had a secret Twitter account which she used to seek help by asking influencers with millions of followers for advice when she had suicidal thoughts. Molly was shouting into a storm. Her desperate cries for help were never going to be heard. The coroner decided to issue 5 Schedule 5 notices to gather more evidence, as we, neither the family nor our lawyers, had had any success in obtaining them ourselves. The data he requested was eventually supplied in differing ways. Snapchat, gave very minimal information and said use the US legal system. WhatsApp were unable to definitely say whether Molly did or did not have a WhatsApp account, even though on the 23rd of March in 2018, they deleted Molly's account automatically and sent Molly's family and friends a message starkly announcing Molly Russell left. Twitter did not provide data, but eventually allowed me to take over Molly's account so data could be downloaded. But this didn't show us what Molly had seen on Twitter. Facebook warned it would take them ages. It did. And they said it would be complicated. It was. And it was also, in their case, very incomplete. Pinterest asked 17 staff to work for weeks to supply whatever data they could about Molly in a form that was accessible. the best example, in this case, of genuine cooperation. Molly's inquest had to be adjourned in April 22 after Meta eventually agreed that they would supply over 50 lever arch files of additional data just days prior. Then again, Meta submitted 1,200 more posts only a few weeks before the relisted September inquest, posts that were among the most harmful Molly had engaged with and data that helped reveal a critical pattern in her behaviour. Data gathering in such cases should be standardized and automized. If we're to take steps to prevent future deaths in a timely manner, it's important also, of course, for the sake of bereaved families. I wasn't surprised it took so long. I'd been warned to expect deflection and delay and that it would be distressing. Our legal team sought professional help to safely review the evidence. The child psychiatrist who'd supplied expert evidence under oath said he'd slept poorly for weeks because of it. And the police officers involved in the case admitted they'd been moved to tears after viewing the content seen by a 14-year-old. The witnesses supplied by the platforms to give evidence under oath, particularly the witness from Meta, seemed to be the only people in the packed court who thought the content Molly had engaged with was generally safe. They frequently claimed that removing admissive content, that's content posted as a cry for help or as part of a healing process, might be detrimental to the poster's well-being. Yet they seem not to have balanced this risk with the risk to others exposed to the content when hundreds of such posts are automatically combined and algorithmically fed to millions of other users. The platforms were also keen to spread the blame to their expert third-party advisors. In the end, the senior coroner concluded Molly Rose Russell died from an act of self-harm while suffering from depression and the negative effects of online content. The papers reported this as a global first. So the inquest touching the death of one of the most caring people I have ever known is now over. Molly should be alive today. She'd have been 20 by now, and we'd have gone on to have lots of other adventures, and I should be looking forward to what I'm sure would be the rest of her extraordinary life. It seems to me that digitally, moving fast and breaking things, as Facebook's Mark Zuckerberg is alleged to have encouraged, has had a terrible human cost. Until online regulation mandates new safety features and increases tech transparency, sadly, will continue to pay the price with more young lives. And the pace of change is accelerating. In 2017, the year Molly died, that was the year that generative large language model AI was invented, I'm told. We're now seeing the rapid introduction of this online into everyday platforms. So regulators and academia will have to run faster just to keep up. The Online Safety Bill has been 5 years in the making, and currently hundreds of amendments are still being debated in the Lords. Realistically, it won't offer enhanced protection against online harms for years to come. Similarly, by following established practices and without sufficient access to data, academia is having to work in the dark. The platforms should be compelled to provide anonymized data for bona fide research. After all, they have lots of data, and there's so much more about the digital world we need to better understand. I'd say we need to move ever faster and learn things. I'd like to end by reading from another of Molly's notes. She said, "I'm sorry that I did this to everyone I love. No one is to blame. No one, but I didn't know what to do. I know you may not understand this, and I pray you never do, but I'm so sorry I never came to you. You're not to blame." I think it's worth saying one final time. The Molly I knew was an adorable young person who showed no obvious signs of any mental ill health. Thank you.
Thank you, Ian. Thank you for sharing Molly's story with us. I'm not sure if you've seen the comments in the chat box. It's had a huge impact on people listening, a really powerful narrative. And I have to say, I think people really inspired that you use that sort of story of loss to really channel this into increasing awareness around the harmful content and harmful impacts of online harm. I wanted to just sort of pass on my kind of reflections. I'm a parent of 2 teenage children. I didn't grow up with social media. I've had to learn really quickly about asking my children about how they use the internet, how they use social media. It made me also reflect about our practice as clinicians. You know, do we routinely ask about online use, online harm with the young people we see? So a huge thank you from all of us here. I think sharing Molly's story has clearly had a really powerful impact on so many people. So thank you.